So can you tell me what your name is and how long you've been at Bryant University?
Okay, my name is Sharon Capuano. I'm a nurse practitioner here. I've been here, this is my 3rd year here. Previous to that, I worked at Rhode Island Hospital for probably 8 years in the Children's Neurodevelopment Center, which you work with children with disabilities. There was a headache clinic, and also did the palliative care, which was end of life for children, so their end of life issues. Prior to that, I've done some private practice and many other things, but so that's about me.
And so how do you enjoy working with college students as opposed to different types of people?
I like working with college students because I think you can make a difference and you can make an impact on some of their health choices. I think that a lot of times they maybe don't have all the knowledge, so perhaps if I make an intervention that it would impact their future choices and hopefully have a positive impact for down the line.
Okay, so what type of services do you offer?
We offer a wide range of services. You can come here if you're sick. If you have questions about your health, we do preventative health care. We just did something on breast, because it's breast month, and we had a whole bunch of things, for women to do breast self-exams. These are testicles for males, self-testicular exam if they never knew how to do that. We have ones for breast. We have a bunch of different things. Immunizations, travel, pretty much anywhere you go for your primary care.
Okay, and do you test for STDs also?
Yes, we do. We do STD testing.
Okay.
And now the thing about that is that it's not free, that goes through your insurance. So, if you have a concern about that, we can test, but it would be billed through your insurance. All the other services are not, there's no charge for.
Okay, and if a student, are your services anonymous? Like if a student wanted to come in and be tested or have an appointment with you for anything else, would you contact their parents?
No, all visits we're covered by, there's the HIPAA and then the FERPA. So basically anything that we discuss is pretty much confidential. Of course, if you were going to harm yourself or others, then I would be bound to sort of contact and make the appropriate contacts.
Okay. So what are some things that you think that students are not aware of about health services that they should know about?
I think people think that they have to be really sick sometimes to come here. I think sometimes if they have questions about maybe their health, they can come here. I'm trying to think of what other things would they not know about. I mean, sometimes people have maybe some stitches that need to be removed. We can take those out for,
Okay.
we can
so anything from something really minor to...
Yeah, so if we can't help, we would a lot of times coordinate or maybe refer out or work with their home provider.
Okay. So do you have any, maybe top 3 or top 5 tips for college students to keep a healthy lifestyle and be as healthy as possible?
Well, one of the big things is sleep.
Sleep
is huge. It's been shown to, your college age students should get 7 to 8 hours of sleep a night. It should be sort of consistent, not all over the place. By age, you guys tend to go to bed a little later than, as you get older. That's part of your biological clock. But I think the big thing we find is that they're not getting really good sleep, so it affects your immune system. So therefore, you're getting sicker a lot. You can't concentrate and focus. So that is huge. And staying away from caffeinated beverages and all those crazy drinks that are out there now with the alcohol. It's Lago.
For Loco?
Yeah, that's not probably a good thing.
Okay.
What would be another thing? Good hand washing. Not sharing bottles, cups, and especially athletes are still sharing water bottles at this point, despite all the education. Safe sex if you're practicing that, so that means using condoms all the time.
Can students pick up free condoms here?
Yes, they can.
They can?
We have some in the waiting room, and we all have some in our exam rooms.
Okay. I think those are all the questions I have. Thank you very much.
Okay.
Bye.